Hello, welcome to 5 Minute Videos. This is Dr. Pepe going over the NCE, and today we are covering the clinical focus, and we are going to be doing subset J, which is gender identity development. So, before we get into gender identity development, let's define some terms that you should be aware of. Sex or assigned gender is the gender that usually the doctors or the person that assists with the birthing usually assigns, and that's usually in their birth. It's usually stated in the hospital. This baby is a boy or this baby is a girl. So sex is a biological, and usually how that determines is by looking at their genitalia. Gender refers more to a spectrum, and that can include both the biological as well as developmental and environment conditions. For example, a male or a female may identify more with one gender over another, and their sex may not correlate with their gender. And worldwide, researchers know that about 90% of individuals, their sex correlates with their gender. So if they're born a boy, then they identify as a male. But then you have roughly 10%, and this is mostly true across cultures. It's just some societies suppress it more than others. So you have about 10% or so where the sex or the assigned gender does not match the gender identity. So there's a lot of self recognition. Children around the age of 2 become conscious of their physical differences between girls and boys. Usually that's done when they go to daycare. They're going and interacting with other children their age. Before their third birthday, most children can easily label themselves as either a boy or a girl. And again, that there's environmental factors that are reinforced for the child to determine what sex they identify in. And then by the age of 4, most children have a stable sense of their gender identity. And again, that goes to that 90-10 roughly, give or take, those statistics. So it's important as mental health clinicians to understand the gender spectrum. Not everyone's assigned sex is going to match their gender identity, and that's important to understand. It's also important to understand environmental factors as well as social factors. Some of those social factors can include clothing, hairstyle, their preferred name or nicknames, as well as their pronouns. Social behaviors that reflect varying degrees of aggressive dominance, dependency, and gentleness. Many times, how they play, that's reinforced as far as their assigned sex. Manners and styles of behavior, physical gestures and nonverbal actions that identifies as masculine or feminine. And then social relationships, including friends and people that they look up to or that they see on a daily basis or that they decide to imitate. So when a child's gender specific behavior, gender expression, at any time seems to be influenced by exposure to stereotypes and their identification with people in their lives, the internal sense of being a girl or a boy, in between, or something else. So that kind of gets into the whole spectrum of, how do I identify, and does my sex match my gender and how I want to be to portray myself. So that's something that's very important in the field of gender identity development.